Diagnostic evaluation. The term diagnosis means identification of diseases by means of patient symptom. Diagnostic evaluation is concerned with evaluation of people learning difficulties during the instruction. Diagnose to analyze individual performance and provide information on the causes of difficulty. Tests used to diagnose or to reveal an individual weaknesses and strength in a certain course of individual. Tries to discover the specific area of weakness of a student in a given course of instruction and then suggests remedial measures designed to analyze individual performance and provide information on the causes of difficulty. Evaluation is concerned with the finding of the reason for students' persistent and recurrent learning difficulties. Observational techniques can be used to diagnose. A good diagnostic test is one of that goes beyond estimate of individual overall ability level step. Silent phases of diagnostic evaluation. Diagnostic test. The diagnostic test up where the formative test leaves up. A diagnostic test is a means by which an individual profile is examined and compared against certain norms and criteria. Diagnostic test focuses on individual educational weaknesses or learning deficiency and identify the gaps in people. In the classroom, there are the three types of students: the average learner, below learner, and high level. So, how the teacher knows that? How we knows that it is a below learner if we diagnose or not? So we have some criteria for diagnose the student, for to know the students how much they are learning or not. Diagnostic test is more intensive and act as a tool for analysis of learning difficulties. It is a type of tool because in this tool, in this test, we know the average level, mental level of the student. Diagnostic test is more often limited to low ability students. Diagnostic test is corrective in nature. Diagnostic tests pinpoint the specific types of error each pupil is making and search for underlying causes of the problem. Diagnostic test is much more comprehensive. Diagnostic tests help us to identify the trouble spots and discover those areas of students' weaknesses that are unresolved by formative tests. Then diagnostic assessment help us to identify that when we diagnose a student, we know the weak areas of the student. Before the diagnosis of the student, we don't know the weak areas of the student. First, after diagnosis, we know that this weak area, then we will start the work on it and we will resolve this problem. And this test, by this test, we know the weak areas of the student. Yes. Steps of educational diagnostic test. Identification and classification of people having learning difficulties. Constant observation of people, analyze of performance, avoiding assignment and copying from others, informal classroom achievement tests, tendency withdrawal and gap in expectation and actual achievement. First, we observe the student to know the learning difficulties of the student. Determine the specific nature of the learning difficulty or errors. Observation, analyze of oral response, written classwork. Analyze of student assignment and test performance. Analyze of cumulative and anecdotal record. Second one, we analyze the students of the written work because the written work much more tell about the students level, and we can see by the anecdotal record how much they are progressing in the learning. The third one is to determine the reason or causing of the learning difficulties or data collection. Retardation in basic skills, inadequate for study skills, scholastic aptitude factors, physical, mental and emotional personal factors, indifferent attitude and environment, improper teaching methods and unsuitable curriculum, complex course material. Fourth one is remedial methods treatment to rectify the difficulties. Providing face-to-face interaction, providing as many simple examples, giving concrete experiences, use of teaching aids. Now, how we rectify the difficulties face-to-face? If in the classroom we have two students to diagnose, then we interact with face-to-face. No, interact with and talk to with them, that how much are they are telling and what is the problem of the student, and use different teaching aids to resolve the problem of the weakness of the student. Promoting active involvement of the students, consultation of doctors, psychologists, counselors, developing strong motivation. If the problem is big, you are not you can't solve it, so consult the psychologist, counselor, or doctor. They are the different fields we consult in for the betterment of the student. Yes, developing a strong motivation, prevention of recurrence of the difficulties, planning for non-recurrence of the errors in the process of learning. Yes, here are the main elements of diagnostic elements. Elements means how we take a step. First look, then plan. First we observe the student, what they are doing, what are they are doing. Just look, then plan how you react in that problem. First you observe this problem, but without planning you can't act. First plan how you interact, how to engage with that problem with the students. Yes, then act. After the planning, then act. And after the act, when you see, then again observe that your action, your planning is performing or not, your planning is working or not. Then observe and then reflect, that you reflect how much your diagnostic test is reliable, how much your diagnostic is valid, how much diagnostic test is transparent, and it is work or not. These are the elements you diagnosed to student in this way easily. Benefits of diagnostic assessment. What are the benefits of diagnostic assessment? Yes, here are the some benefits of diagnostic assessment. Indicate students' prior knowledge, assess the learning that has occurred during teaching and learning. Assess the learning that has occurred during a teaching and learning session, can help instructors adjust content and activities to encourage more effective learning, may make the teaching learning process more efficient and effective by zeroing in on the content that needs to be taught and mastered. Diagnosis can improve the teaching because of that for the 2 or 3 because of the 2 or 3 students, all classes are suffering for the learning. So for the by the diagnosed to student, your teaching is improved and your all student in average or high level learning in the classroom. Can help a student understand the value of a lesson, module, and entire class. And in this way, the students then participate in the learning, participate in the activities, and you can help and engage easily after the diagnosis, because you warm up the students by the diagnostic test. Can point out the students in the gaps in the students' reasoning and misperception about the subject matter. May motivate students to seek accurate information and practice. Demonstrate to students that their instruction care about them as people and about their success as learner. Demonstrate to students that their instructor care about them as people and about their success as learner. To realize the student that they can do everything, and they are doing easily and push up to the successor and the learner. Now Here are the examples of diagnostic evaluation. First one, the for reading. Examples: diagnostic tools provide data to assist educators in designing individualized instruction and anticipating intervention for students who do not respond to validation intervention program. Diagnostic tools can be either informal, which are easy to use tools that can be administered with little training, or standardized, which must be delivered in a standard way by training staff. Yes, diagnosis can be either formal. Here are some type for reading, for math, and for behavior. For reading, the errors analysis of literacy progress monitoring data, phonic inventory, reading miscue analysis, running record, intervention, curricular specific diagnostic, word list reading, curriculum site words list. In reading, we can diagnose that how students know the students phonics, fluency, comprehension, vocabulary. So we diagnose the students in this way: phonics inventory and sight words. We diagnose to student in reading. In maths, for maths, error analysis for maths progress monitoring data, computation error analysis practice, mathematics assessment supplement, analysis of students' work and classroom assignment work, sample tests, intervention curricular specific diagnostic tools, observation and anecdotal notes, etc. For behavior, interview protocols, checklists and planning tools, observational tools and collecting anecdotal evidence, etc. For behavior, we use the checklist and protocol interview. Uh, we can't just observe to diagnose the behavior. We interact, we talk to face to face the student. So we can take an interview, we can take a checklist, and better use the planning tools to know the behavior of the student. And we can see also the record of anecdotal record or evidence to know the students behavior. Yes, there are the many strategies to know the behavior of the students, the diagnosis of the students. Yes, thank you.